Good afternoon, I'm Dan DeRosa with 19 News Now, coming to you from our digital studio because we want to bring you this breaking news situation, a news release that has just gone out from the Cuyahoga County Medical Examiner's Office. Yet another red flag, a rash of deaths. And when we start talking about the numbers, you will be able to see why the medical examiner is trying to get the word out. There have been 6 overdose deaths in just the past 24 hours. There have been 10 in the past 3 days. When they get a rash of deaths like that, they send it out to us, the media, right away because they need to get the word out that there is apparently a strong batch of fentanyl, maybe even carfentanil, that is floating around. And before I get into the numbers, because I've been covering this unfortunately for about the last 2 to 3 years, and when we get a list of unfortunately the people who have died in a time frame, normally there's no discernible pattern. But this time there is, and investigators are trying to figure out why. First of all, take a look at the map here. Now, these are the reported addresses. They may not be the exact death where the death and the overdose death took place, according to the medical examiner office, but these are all 10 of the individuals who have died in the past 3 days since the 18th. And that is the closest cluster that I have seen in quite some time. Normally, when the Cuyahoga County Medical Examiner puts this out, this map is pulled out. It includes victims in Strongsville. It includes victims clear on the east side along the lake and on the west side in further out in Lakewood, maybe in Rocky River. But for some reason this time around, here, these red marks that you see, these red dots, are indicating the 10 locations of the individuals who have died in the last 3 days, and they seem to be concentrated a little bit more inside Cleveland. You have one that's almost to Lakewood, you have one that's just past Euclid, but the rest seem to be concentrated. And before you start to think that these are white or black, it is both. That's one thing that doesn't stand out. I can see 4 black victims, 6 black victims, and we've got 4 or 5 white victims here. And so this is, again, a pattern that it's not picking one race or the other. What is interesting this time around, when I start looking at the ages, this is the second red flag that this time it is different. When we look at the ages, we have 56 years old, 61, 69, 60, 64, 47, 46, and then a 31, that's the low, age of 31, then back to 65 and 56 for some reason. And we have asked the medical examiner's office, I have been in communication with the Cleveland Police Department to see if they have some sort of idea why. And one of the questions I asked of the Cuyahoga County Medical Examiner's Office that they are looking into is this idea of blue fentanyl. I'm going to bring Shannon Hauser in right now. Shannon, you just did a real big expose piece on blue fentanyl, because this is fentanyl made to look like what?
Oxycodone, or any type of pill that looks like oxy. So it's a blue little pill, and they're calling it blue fentanyl because it is straight fentanyl, but it is blue. So it looks just like you would get a pill from your doctor's office, from the pharmacy, but it is fentanyl.
And so we've heard this. We know that this is a pattern, that the individuals who've been turning to heroin that might be mixed with fentanyl, and those are the people, a lot of these people started off with pain pills. So this idea that, especially when we see an older population like this, that may be in pain or maybe was going to fentanyl or going to heroin and maybe trying to get out of that, and here they get offered some sort of new, what looks like just a pill. You don't have to shoot it up. This might be a link. You sat down with who to discuss this?
We talked to the DEA, and it's really important to note that there have been a lot of fentanyl deaths so far this year. In Cuyahoga County, the medical examiner's office reporting about 200. But you can't really distinguish between the blue fentanyl and just fentanyl in general. It's not like when they're doing the autopsies, they can say this was a blue fentanyl death. But the DEA does know from their resources and their investigations that it is here in Ohio, it is in Cuyahoga County, and they're tracking the cases that way. So that's why they were trying to get the word out before the pills get into your hands.
Right, and that's why the medical examiner's office is getting the word out right now that unfortunately we have to say this, if you have family members, if you have friends that you know have an issue with heroin, have an issue with maybe taking pain pills, we're going to show them your story that ran just a couple of weeks ago about why this is so dangerous. And when the medical examiner's office throws out a red flag in the middle of the afternoon on a Wednesday that they've had 6 deaths in just the past 24 hours, something bad is going around. Take a look at Shannon's piece from just a couple weeks ago.
DEA agents say cartels could be trying to funnel those drugs through our city right now. Yesterday at 6, I told you about a new initiative with the Cleveland DEA to curb drug violence and addiction that also now includes new investigations into what's being called blue fentanyl.
And these pills can kill you.
Pills that look identical to prescription drugs. These little blue pills may resemble oxycodone, but instead, it's fentanyl, a drug responsible for 1,320 more deaths in the past 44 months than the entire decade prior in Cuyahoga County.
Right now, it seems that's one of the main drugs that they're trafficking here in Ohio.
Cleveland DEA acting special agent in charge Keith Martin says these pills are called blue fentanyl. They're being brought in daily across the border into the U.S. by cartels. And Martin says it's likely these traffickers have thousands of pills on them at a time, ready for distribution all across Northeast Ohio.
We're seeing it everywhere. I mean, it's on the streets of Ohio, so to say it's in one community and not another wouldn't be accurate.
It's nearly impossible to tell the difference between the deadly drug and prescription pill just by looking at it.
And that's what's so dangerous about those pills is, again, they're made so well that it takes a chemist to test those and to find out if it's actually oxycodone or if it's fentanyl.
That's why Martin says don't even attempt to buy or use the drug unless it's straight from your doctor or pharmacy.
Don't take these pills. You're playing Russian roulette with your life.
The Cuyahoga County Medical Examiner's Office predicts there could be more than 750 overdose deaths in our county alone this year. Reporting in Cleveland, Shannon Hauser, 19 News.
Shannon, when you went through that with the DEA, what stood out to you? We get very little access to the DEA. They generally, they're on a federal level. The fact that they wanted to sit down with you, is that what stood out to you?
Oh, absolutely. I mean, it was great to have the resource that specializes in drug enforcement to be able to talk to us personally. We're very, very thankful they took the time. It is very rare that we get access to talk to the DEA, so it is important. They wanted to get the word out and really just stressing, especially as kids are going back to school, we hate to hear about, possible incidents where kids are sharing pills back and forth, but just don't take it unless it is coming straight from the pharmacy. Don't take any little blue pills, or really don't take anything that unless it's prescribed directly to you by a doctor.
If you're just joining us, the reason we felt compelled to do this on our digital platforms is because of this news release that was just sent out by the Cuyahoga County Medical Examiner. They have had 6 what they think are overdose deaths. Of course, there's tests and blood work and toxicology work that has to be done. I want to read the statement briefly. As you look at the map, again, what stands out about this map is how clustered really to Cleveland that these cases are. Normally in Cuyahoga County, when we get maybe a weekly report or a monthly report, these, at least the residents of the people who have died, are more spread out. They're all throughout the county, but you can see that's not really the case here. I want to read what came from the medical examiner himself, Dr. Thomas Gilson. He said, "We are seeing another cluster of apparent overdose deaths. Our recent experience indicates that this is likely related to fentanyl, possibly also carfentanil. These dangerous drugs may be mixed with other drugs like cocaine or heroin, with significant increases in the risk of death." The doctor goes on to say naloxone kits, fentanyl test strips, and not using drugs alone are some of the strategies that have been shown to save lives. Some alarming numbers to come out of Cuyahoga County. They want us to get the word out because perhaps, unfortunately, you know somebody that has a problem with this, that is taking pain pills, that has gone the route of fentanyl or heroin. The word needs to get out that there is a bad batch of something going around and has killed 10 people in just the past 3 days in Cuyahoga County.
And part of the importance of it is you never know. It doesn't look any different. You know, the heroin that you get doesn't look different. It doesn't look like it has fentanyl. These little blue pills, you can't tell it's fentanyl. There's no difference. Actually, a chemist is the only person that can tell the difference. So just don't use them. Don't do them. You're really, I mean, they always say you're playing Russian roulette with your life, but it's true. It's a true statement.
And that's again, this list right here, these are the 10 individuals in the past 3 days. 10 people have died. They are dead. They overdosed. They are dead. Their bodies are laying in the medical examiner's office right now because of apparently a bad batch of drugs, of fentanyl or carfentanil that has been mixed. We are seeing an increase in the county in cocaine deaths. And people are saying, well, how can there be an increase in cocaine deaths? It's because it's being mixed. It's being cut and it's being mixed with fentanyl. So the word has to get out. If you share this video, share it with somebody that you know, unfortunately, that has gone down this road of pain pills and heroin and now fentanyl before something dire happens to you or your friends.
And we can bet that investigating agencies are out there, whether it's the DEA or Cleveland Police. They're all looking into this. Newburgh Heights Police, I see here, Maple Heights, Lakewood, even Macedonia. We can bet they're out there investigating this as well, and that they're looking into these particular cases. And one thing that the DEA did share with me, when they are mixing things with fentanyl, when you've got the pills that they're mixing with fentanyl or the heroin that they're mixing with fentanyl, it's not always happening here. It's things that are being brought into here. So that's something very important too. They're out there, they're on the roads, they're doing their investigations to try to stop that before it gets into Cleveland. Unfortunately for these 10 people, it was a little bit too late for
There's
them.
only so much that they can do. It's being mailed in, it's being driven in, it's being shipped in, and the investigators are doing what they can. We're going to have much more on this coming up in an hour and 10 minutes when 19 News comes on at 4. But again, we wanted to bring this to you right away on our digital platforms before yet another life is lost. So want to thank you for taking the time to watch this video. Remember, as we get breaking news in throughout the day here to 19 News, this is how we bring it to you right away on our digital platforms, because news doesn't just happen at 4, 5, and 6. It happens now. I'm Dan DeRose, along with Shannon Hauser for 19 News Now. Thanks for watching.
19 News. First, fair, everywhere.